손가락을 뒤로 쫙 작게 올리세요. 자, 버티십시오. 네, 다시 빼시고. 자, 새끼 버티십시오. 자, 네, 됐습니다. 다시 한번 하고요. 적기십시오. 네, 됐습니다. 네.
Hi everybody, this is Dr. Bachman at Austin Spine and Sport, and today we're going to talk about tennis elbow and self-treatment. So we see this condition quite often. It's classified as an overuse or repetitive stress injury, and classically lateral epicondylitis, which is the clinical name for tennis elbow, or medial epicondylitis, pain of the inside of the elbow, also known as golfer's elbow, are caused by the same kind of causes. Basically, you asking your elbow to do some work that it is unable to do, therefore it fails on some level. And each of these conditions are famous for lingering, for becoming nagging injuries that just don't respond to treatment or repeatedly come back and bother you. So we're going to go over self-treatment using the flex bar, which is a very effective treatment method. And it's a little tricky as how to set up for this treatment. It's an it's an eccentric wrist extensor or flexor exercise. So if you have lateral elbow pain on the outside, you're going to start holding the flex bar. By the way, I have a link at the end of the video. These are about 17, 18 bucks. Start holding the flex bar in your affected hand, the side of the side that hurts. Grab it like this, and keeping your grip, bring it down to a comfortable level about your waist. And then you're going to release that twist over 4 seconds. And then crank down on it like you're twisting the throttle on a motorcycle. Release over 4 seconds. You're going to feel this the outside of the elbow. You're going to feel these muscles working. And the protocol is 3 sets of 15 daily for 6 weeks. And somewhere around 75 to 80% of patients who do this technique see dramatic results. So to treat medial epicondylitis or golfer's elbow, you just reverse it. So the affected hand holds the bar facing down. Grab this way, keeping your grip lower here, and then crank on the gas of the motorcycle for 4 seconds. And reload, 4 seconds on, reload, 4 seconds. And if you need any additional information, I've attached a link at the end of the video for how to purchase this flex bar, also for the protocol and photos. So hope you guys have a great day. See you later.
Hi, I'm Bob Johnson from MedFax. I've been designing, manufacturing, and teaching people how to use TENS units for about 30 years. What will become crystal clear is I do not have a degree in art. And this is supposed to be your spine, your head, your legs, and we're going to talk about how you use your TENS unit in order to get rid or modify the pain that you're experiencing so that you can become more functional, you can go outside, you can go to sleep at night without having those issues of pain keeping you awake and causing problems. We're going to go through this very quickly. I just want you to understand a couple of principles. Does not matter where your pain is, the principle is still the same. You have, with the TENS unit, you have some electrodes, which I'll show you here, have little wires on them that you plug into a cable that you see here that plugs into your unit, your TENS unit. All right, principle number 1. Is we identify your pain area. In my artistic rendering, you see pain here at the lower spine. We put one electrode, top right-hand corner, electrode top bottom left-hand corner. So we're trying to establish a crisscross pattern. Now, this particular cable is plugged into channel 1. You can turn it on here, and you turn it up until you feel a little tingling sensation. All right, next you take channel 2, which is plugged in on this side of the unit, channel 2. There's your on button that you turn. Don't turn it on yet. You take one of your electrodes, put it in the bottom right-hand corner of the area that you're experiencing pain. Take the other electrode and put it in the top left-hand corner. Put it up here. Save this because we will store our electrodes back on here. Now, this is all relative. It's according to where you experience the sensation of pain. Now, when we turn the unit other side on, channel 2, you'll hear a little beep on your unit that lets you know it's on, plus the screen comes on to show you what the different parameters are. All right, unit comes on, you're feeling some stimulation here. Turn channel 2 up, you start feeling some more stimulation. Both of these channels are basically shooting little pulses of electricity at you anywhere from 50 to 150 times a second. You feel it as a little skin buzz, a tingling sensation. All right, once you feel that, you've turned the power up. Pull down front of the unit. You look here at what it says. It'll come back on and it'll say either rate in this little button right here, this little area, or it will say width. It doesn't matter. What we want to do is we say, all right, we're going to do rate, and on this one, rate, when it first starts off, as long as it's between 60 and 150, it doesn't matter. So you can use your arrow to go up if you want to increase rate, or down if you want to decrease it. All right, once you've done that, you set it. As soon as you finish setting that, then here comes width. When we look at width, we always want to start with width at the lowest it will go. That's 50 microseconds. I held the down button until we got to 50. All right, now, you've probably lost some of the skin sensation, so you turn the power back up a little more on both units until you feel the skin buzz. Now you increase your width. As you are increasing your width, you can push this in, and it'll start increasing. And what you will feel as it goes up, it will now feel like that sensation from the TENS unit is actually going deeper and farther. All we're trying to do is cover the pain area with the sensation that is not painful. If we can achieve that, you're going to be doing fine. Once we've got that sensation, you've got your width up, you're feeling it, close it, push the top down. That's so you won't accidentally hit the button and make it go up. Take the unit. You can either put it in your pocket, you put it in the little case that Medfax provides, which is a little fanny pack, and we have over to the side an area where your wires can come out of. Put your unit inside, your wires come out, strap it on, put in your extra electrodes, batteries, whatever you need, and that should be all that you need, and you use the unit then. When you get ready to go to sleep at night, if your pain is great, wear the unit all night long. If you get ready to go outside, your pain is great, wear the unit, whatever you're doing. The key to this is whenever you feel pain, use your TENS unit. That's all you have to do. If you turn it off, pain comes back, turn it back on. I hope this helps you. This is our little simple step-by-step guide as to how you use a TENS unit. Again, thank you for using Medfax. If you have any questions, you can call us 800-937-3993.